resilience training for doctors? I'd like to look at two reasons. The first of those is to do with us, and it's just recognizing that things are tough right now, that pressures are increasing. Morale has been described in some of the medical press as being at an all-time low, and there's many of us find ourselves working in a more for less culture, and also living at a time of organisational stress, where symptoms of organisational stress can include, for example, people experiencing bullying at work, feeling unacceptable demands being placed on them at work, that there's a lot of pressures, not just in terms of personal stress, but also a larger collective stress that we may find ourselves experiencing the downside of. And so it's no surprise then that particularly the kinds of pressures doctors have been under, doctors have always been at higher risk of stress-related harm. But a recent survey of GPs, general practitioners in Britain, found that the stress rates were at an all-time high that they'd been measured, certainly highest than any other point in the last 15 years. And I'm just wondering, I'm just putting up two images here, one of somebody juggling so many plates, and another of what I call a corner. A corner is where we're squeezed between a must and a can't. And I'm wondering whether any of you listening to this recognise either of those conditions, where you're finding that you're juggling so many plates that you're finding them in danger of falling and breaking, and that's a very serious consequences if they do. Or whether you find yourself caught between these two demands, that you must get it right, you must succeed, but the context you're in makes that extremely difficult for you to do. And that it's no surprise, or I'd say don't be surprised, if you ever find yourself in a dip of your mood, of your morale, of your energy or your confidence, because as I've mentioned, doctors are a high risk group of stress related harm. On average, we're actually more likely than our patients to suffer from depression. We're also more likely to experience marital breakdown, to experience drug and alcohol problems, and also to have cirrhosis of the liver or commit suicide. They're rather disturbing statistics. And I'd like to see that as the backdrop of what we're looking at today, because doctors, physicians as a group are in greater need for resilient strategies. But there's also a second reason that I want to look at, that what we're going to be looking at is two sides of resilience training. One is that we're going to be looking at practical learnable tools for personal benefit that can help protect us from adversity and help us make the best of difficult conditions. But the other side of resilience training is that I'm wondering, how often are you with patients, or maybe trainees, or maybe even family members, or friends or colleagues who could do with help in dealing with the challenges they face? And this is the other side of resilience training, because resilience training can help us help others help themselves. And that's really what we're going to be looking at. But when we do this, a big question may come up is, well, does it work? How do we know that any of this is going to make a difference? And so what I'd like to do is introduce three sources of evidence that really the evidence base is very strong that resilience training works. And I'm going to be looking particularly at the work around the Penn Resilience Programme, one of the most investigated resilience programs in the world. There have been at least 20 controlled studies, including at least one of those a randomized controlled study of the Penn Resilience Programme. And they've shown, the result of those studies, that resilience training can reduce the risk of depression and anxiety. And also, I'm going to be drawing attention to the Comprehensive Soldier and Family Fitness Programme. The US Army was so taken by the results of the Penn Resilience Program developed by a team of psychologists at the University of Pennsylvania, that they brought in Martin Seligman and his team to design and develop a resilience training program for over 1 million US Army personnel. And that already in the 5 years that it's been running has been, or certainly since it's been developed, has been extensively investigated, and I'm going to point to some of the research findings from that too. But there's also been a lot of research around resilience training in the workplace, and I want to touch on a research review there. But first of all, one of my hopes of this training is that by this webinar, is that by the end of this session, you'll have a clearer idea of what the Penn Resilience Program is, because I see it as hugely important. And I'm going to be drawing on just right now a research study published 20 years ago in 1995. And this was a study with school-age children. And with a control group, what they did, and I see this graph here as hugely important, that it's a research study where one group had an intervention. This was actually looking at children at higher risk of depression, and they got them to fill in a questionnaire, the Childhood Depression Inventory, at a number of points, both before the intervention and a number of points after the intervention. The intervention was 12 sessions of an hour and a half resilience training. And this study, I think, is hugely important because a year after the intervention, this is compared with a control group. This here is the group who'd had the resilience training. You can see a very significant reduction in the number of children scoring highly on this depression questionnaire. And what happened in the control group is that over time, the levels of depression increased, which is actually what you'd expect. As children get older, the depression levels rise. It's sad but true. Certainly a number of studies have shown that. And so at 2 years after this intervention, the control group who hadn't had this resilience training had about twice the number scoring highly on the childhood depression inventory, whereas the intervention group had about half the number of children scoring highly for depression. And for any psychological intervention to have such a significant measurable impact 2 years after the study is really very significant indeed. And so this was an intervention where, as I said, it was 18 hours of structured taught sessions. And they had a number of elements. It was like a kit, really, of a number of elements that would help children deal with bumpy moments, challenges and dips, including challenging unrealistic negative beliefs, strengthening their problem-solving skills, learning assertiveness, improving their ability to cope with strong feelings, and also tackling procrastination and some decision-making tools too. And it was as a result of that study and a number of others that followed it that the US Army became very interested. General George Casey, the Army Chief of Staff, he called in Martin Seligman, invited him, Martin Seligman being the psychologist, one of the team here, really one of the perhaps most, I've seen one of the most important psychologists really in terms of the work that he's been developing, often described as the pioneer or father of positive psychology. Martin Seligman's part of a team. They developed this comprehensive soldier and family fitness program, and they've done a study where they've compared groups in the army where they've had this training, looking at company levels with companies that haven't had this training, and they found that it's led to a significant reduction, significantly fewer diagnoses of drug and alcohol abuse, and also significantly fewer diagnoses of anxiety, depression, and post-traumatic stress disorder compared with control groups who'd not received this resilience training. I think this is hugely important because although US Army personnel are different, have different pressures to doctors. They are also with a group with some similarities in their risk profile, in terms of this is a group with higher than average levels of depression, anxiety and suicide, and also drug and alcohol problems, so in similar way that doctors are too. So it's led to the question of maybe we ought to be having the same kind of training ourselves. And that's I've been very influenced by Martin Seligman's work. I did some training with him a number of years ago, nearly 10 years ago, and that's really influenced the resilience trainings that I've developed, that I've worked a lot with doctors and other groups too. But I'm also drawing on the research of resilience training in the workplace, and systematic review was published actually just very recently in the Journal of Occupational and Organisational Psychology, and I'd point you towards that, and I've got a link to that in the free online trial that we're running at the moment from resilienceForDoctors.com. So I would say, in response to that question, is there evidence that resilience training works? I'd say it's very compelling. The evidence base is very strong.